Hi, my name is Caitlin Glennon, and I am currently a freshman at Valencia East Campus. Today is October 27, 2018, and I have chosen my mom, Becky Glennon, to be my interviewee for my career interview. In the future, I would like to be a child life specialist, and my mom is a social worker, but luckily the two jobs were similar enough to where I could interview her and get similar responses. So, first question. What is your current job title slash position, and how long have you been in this role?
I am currently a social worker at Good Samaritan Medical Center in West Palm Beach, Florida. I've been in this position about a little over 90 days.
How did you land this position?
I worked, I was looking for a job for 2 years since we moved here to Florida, and I was having difficulty. So what I did was I saw a ad on Facebook for nursing open house at Good Samaritan, and I just showed up and took my resume and said that even though I wasn't looking for a nursing position, I was looking for a social work position. And the human resources person called down the director of social work, and we talked shortly, briefly, and then I eventually got called for a job interview.
What do you do? What do you enjoy most about your job?
I enjoy seeing good outcomes with my job. That gives me the most satisfaction. And by a good outcome, I would say like people going home that are healthier than when they came into the hospital, or um, just I guess basically being able to go home.
Do you work in a team or an independent environment?
Even though the approach is supposed to be a team approach with a case manager and a social worker, I feel like it's more of an individual environment where the social worker does the discharge planning, make sure that the patient's going to need, gets the services that they're going to need after discharge, whether it means going to a skilled nursing facility or going to a home with home health care, or just maybe not even needing anything, whereas the case manager does more of the case management part with the insurance and reviews of the insurance.
How does this style impact your work? Meaning, working with others can be challenging, supportive, helpful, frustrating, and working independently can be lonely, empowering, difficult, etc.
I find it as lonely. It really wasn't what I thought it would be. I've been in different situations where I felt like as team members you work together better, so I find it lonely.
What do you like least about your job?
I least like the political part of the job, like I guess the paperwork and having to deal with insurance companies, trying to get equipment for people, trying to get services for people, and just really having to struggle with the insurance company in understanding why these people need these services or benefits.
What was your major in college?
Well, I tried to major in nursing 2 times, and neither time it didn't work out. So initially, nursing was my major, and then I ended up with a Bachelor of Arts in psychology because I wanted to work with kids, and then I eventually ended up with a master's in social work.
Can you please describe your career path to your current job?
Well, I knew from the age of like the third grade that I was going to work in the medical field because I always wanted to understand that. But when I was younger, like 5 or 6 or 7, my mom was sick a lot, so I didn't understand why she went away to the hospital or she was in the hospital a lot, and that's kind of where I came to thinking that I wanted to help with people that that were sick. And what I really wanted to do was work with their families and help kids understand why family members are sick.
Would you say your career choice helped influence my career choice?
I think so. I've always been very open about my career choice, and I've always encouraged you to talk and think about what you wanted to do and something that you thought was going to be fun. And when I started 30 years ago, if I'd really known about a child life specialist program, then I probably would have went into that instead of social work.
One last question. Can you briefly describe how similar and different a child life specialist is from a social worker?
Well, I think with the child life specialist, you do work specifically with the child, and I work with adults and their families, like old adults, geriatrics, and mine mainly is with adult specialty, whereas child life specialist, I think you're going to be working more with the children and then younger families, like siblings or parents, younger parents.
Okay, that's all the questions I have. Thanks, Mom.
You're welcome. Love you.
Love you.